Good afternoon. This is Will Morris with another Transformation Tuesday. And we have a tremendous panel today addressing the elephant in the room, the need for community innovation, specifically around health disparities and health inequities. As always, I'm the least smart in the room, and we have an embarrassment of riches of a real diverse voice in community. So we'll start off with Melba Moore. So Melba represents, is the health commissioner of the Cincinnati Health Department, but more importantly, and we'll make sure we have links to this, has really kind of led a lot of the statewide efforts around minority blueprints of success. Certainly well before COVID, but going forward is what is that roadmap and how do we actually address this? So it's a pleasure to have Melba with us. We have Dr. Nazleen Bharmal. She's the Associate Chief of Community Health and Partnerships at Cleveland Clinic. And lastly is Daniel Knecht, who is the Vice President of Transformational Clinical Product at CVS Health. Thank you all. And maybe I'd start off with Melba, kind of wearing a health commissioner hat. Tell us a little bit about the landscape. What do we need to know about kind of the truths of what are we dealing with and what is the potential roadmap ahead?
Thank you for the invitation to be a part of this panel and just to have a conversation about it. I think I go back to several years ago, there was Health in All Policies. And it was an opportunity for multiple disciplines to take a look across state, local, and federal organizations to ask some questions about how are we addressing our minority communities? What are we doing? What can we do more? And then when we think about policy, we need to be deliberate and intentional of really looking across policies to ensure we're doing no harm. So what does that mean? That means every organization takes a look at themselves. What are they doing? How are they doing this work? When you think about the social determinants of health, I said earlier, it's connecting the dots. If we've learned nothing out of this pandemic, we cannot work in isolation. It is public and private coming together, working together. Everyone has a role to play. So if you just think about that, you get settled. I think about public health, that for me to make a decision, I have to have data, right? We make decisions based on what the data is telling us. We know we have health disparities. So knowing our platform, right, that there are health disparities that exist in our communities of color. When we introduce something new, pandemic, you know that there's going to be a great impact, a disproportionate impact to what you already know. So one of the things that I really liked, I didn't like that we had to go there per se, but I was appreciative of the fact of having and being on a committee that focused on data. Let the data guide your decision-making. Track the data. We need to make sure that we have race and ethnicity data out there and that it's accurate. So when I pull that back, it's always pulling back another layer and looking at it. My word for this week is check your facts. Check your facts. So you pull back that layer and you check and see what's going on so that we can make some better decisions. And that's why the initial group that was formed with the governor, out of the governor's office at Minority Health Strike Force, and that data community, the committee was so important because they talked about racial, ethnic data and primary language. So somebody said, well, why primary language? Well, we want to talk to people and we want to make sure our message is appropriate. I think I shared here about my conviction point, and you asked about a tipping point. It was a conviction point for me when I'm at a press conference talking about what we were seeing in the Cincinnati community, and I talked about African Americans. I was convicted because after I left that press conference, I had a nurse who was talking about what she was seeing in one of my communities about my Latinx families. I didn't have the data. So, I took it personal and said, what is that community thinking about me? That I just disrespected them? That I don't think that they're important enough? And that's the thing for me and data and knowing who. It's important that we have everyone, that we think about that. And I'll pause there.
Now that's, I think, profound insights, Melba, of the power of knowledge, right? You accept the things you cannot, that you're aware of. Nazleen, I know, you've been leading the charge for our, community efforts in expanding that role for access of primary care. How does that resonate? I mean, we have the data. What are you doing to kind of, take that information and make it actionable and make it accessible and digestible?
Yeah, first of all, thank you for having us on this panel and broaching this topic. Couldn't agree with Dr. Moore more. We absolutely, I know, right? We absolutely need to think about vulnerable populations. Race and ethnicity is one component. Understanding literacy is another component, limited English proficiency, but also age, sexual orientation, where they live. We know your zip code has a greater impact on your health than your genetic code, and your place matters. And understanding all of those vulnerabilities that a particular person or community might have, I think is incredibly important to then generate targeted interventions. So I would say that for Cleveland Clinic, we've sort of embraced caring for community as one of our primary health strategies. We have a strategy that's about healing, about hiring local, because we know nothing moves without having jobs, and talking about wealth and income. You can have food deserts, or you can talk about access to healthy foods, but without a job to actually buy those foods, it's a moot point if you build a grocery store in a food desert. And investing in our communities. We know it's not just about individuals, but it's about the community conditions that they live in. Is it a safe space? Do they have affordable housing? Do they have affordable, reliable broadband? And that actually gels into this conversation about access. So when I think about access, I think about two specific points of access. Yes, access to healthcare, which right now in the COVID era has really been about your access to virtual health. So reliable, high-speed broadband access. We know so many people, the communities, of course, and the patients that need it the most are the ones that are suffering and that don't have it. And that might be not just about access to Wi-Fi, but they might not have the equipment or the digital skills or literacy, especially for our older population. And then I think it's also about what we've been doing, which is outreaching to patients. So I know that they have a chronic condition, we know that they have COVID, actually making the effort, either using technology or just a phone call to see how they're doing on a regular, consistent basis, screening for their health-related needs and connecting them to the resources we know are in the community. But I think another point of access is a conversation we've had a long time, which is, yes, making the hospital a comfortable place, no matter who you are. So, at Cleveland Clinic, a major integrated health system, can be quite intimidating to many folks. And then also meeting people where they're at. So making sure we have community health centers or we have access. We are in conversations right now to embed primary care as part of community-based organizations who already have the trust of the community, who already have the expertise, might not have clinical care, and us partnering. So the word I definitely want to use for access is partnering, partnering, partnering.
I love that theme. And actually, it segues beautifully into, Dan, you are, ahead of transforming clinical products, but, you can't transform a clinical product without really understanding your core user and your community in which you serve. How does all of this kind of conversation and framework, these brutal facts, influence, guide, shape CVS in this very, very germane topic?
Yeah, absolutely. Well, first of all, thanks for having me. I'm thrilled to be on the panels with my fellow doctors. Really great opening comments, and I think I'll sort of pull together what I just heard in sort of framework of how, I think about it with my team. So in order to make like a meaningful community health impact, you need the analytics and the data. And the challenge we've had to a certain extent is making sure the data is accurate. So, for example, claims data is a little bit more, I'd say less granular than you get electronic medical record data or data from patients. But anyway, having the data and analytics, and I will say, despite those limitations, we have a vast repository of data we can use. Number two is actually taking the data and interpreting it and infusing it with clinical and health insights. So like we have the data, what does it actually mean? And then finally, an effector arm, or how do you actually make a meaningful impact on the data, on the people we're serving? So, that's arguably the biggest challenge, I think, for large corporations. But I think CVS is pretty unique in that we have about 10,000 stores across the country, and it's estimated that 85% of Americans live within about 10 miles of a CVS. So that's a pretty broad reach. But to make it really impactful, how can impact people's health, it needs to be certainly local, personal, culturally appropriate and relevant. And then frankly, it can't be just really narrowly focused on medical care. It has to be, as we heard earlier, addressing social determinants of health, poverty, food deserts, and all the other components that really drive holistic health. So that's the framework to how we build clinical products. I think just one other comment that's really important is when you build clinical products, you have to develop a deep understanding of who you're serving, who the end user is, and I think you do that by having the end user join your team, helping you co-create these products. So, for example, if we're building a product to address women's health, certainly you need women on the team helping you develop these products. You need women from communities of color on the team building these products too. So I think that's just another important call out.
I could just jump on that point. I just want to echo, it's especially for healthcare systems, and want to just really acknowledge the work of public health and of private companies, but you have to have power sharing in order to have a real conversation about health equity. And that can be challenging to do. But if you don't have the voice of the people that we are overall all trying to impact, what can usually end up happening is unintended consequences, where we are not consciously, but unconsciously making disparities worse. Virtual health is a perfect example, where if you're not intentionally thinking about it, you're actually making disparities worse.
And so there's so much to unpack, talking about kind of the unintended consequences, but something that occurs to me is trust or mistrust. And how do we actually address that first? Because you can have all great intentions and you can have the magical app and the magical outreach and healthcare in aisle 3, but if we don't have trust, and it certainly is a complex question, but I'm thought of, Melba, your perspective from a public policy, public health perspective, and then I'd love to hear, Nazleen, Dan kind of talk about that. How do we actually engender trust? Melba, you're on mute. That's we're not talking about technical literacy today.
Right. So I think about when I think about this trust, it's today, and a situation occurred that I had to intervene, and it was based on some erroneous information that I was provided. And I happened to be following up on my recommendation. I followed up with that person, and that's when they told me, oh, well, it wasn't that person. And I said, let me go back. I took the time to go back to the person that I talked to, and I apologized. And what I know about working with communities, when we make a mistake, apologize. You know, we know more now. We need to be better. You know, and that's what I went through that process and saying, you know what, I'm really sorry. And I've had this conversation before about me not having the data. And I shared that with my team I was working with. I've shared it with others. I've shared it here to apologize for that because it wasn't intentional. It was, remember I said, check your facts. I had limited information at that time. We now have more information because what I did was I took steps to make sure we had a system in place that would not happen again. So it was working with the funder and reaching to the health systems and saying, can we come in and provide some frontline training for individuals so that when they're interfacing people, it's motivational interviewing. We want to make sure we gather all the information so that we have a clear picture. Those are the things, and I think that's my process for building that trust, because when I went back and said what I did, now that person that I talked to is like, wow, the commissioner came back and said this to me. And now we're going to go talk to the person who really created that fluff there today. So we can smooth that out and help them understand. Here are all the people that were impacted by not taking the time to do what we need to do. I think making that being intentional about that when we make a mistake, when we recognize that we have biases, and I use the example of being biased towards, I might say, a fabric, but we know we all have biases. You know, I love silk, I love cashmere, right? But if I have a bias against cotton, you know, I might be missing something out because in the summertime, that's the best thing you can have on. It's cotton, it's cool, it's light, right? So that's what I'm saying. We have to recognize our biases for real and say, I'm sorry, and be intentional about course correcting, having those conversations. And it really begins here and in other venues and having those tough conversations where you want it smooth. You want to smooth it out.
Mm-hmm.
I could not agree more. So well said. I love the cotton cashmere analogy. I would say, you know, for us that you have to, we use this, we throw trust around like a word as if it's so easy to do. And as a primary care provider, I mean, I would say really building authentic relationships, meeting people where they're at. If you're going to say you're going to do something, you follow through. But in the context of COVID and health disparities and access, I think there, as Dr. Moore said, there comes an important, you must acknowledge that there is a history behind distrust and the role, for example, a healthcare institution may have done to enable that. And then starting from there, that acknowledgement, and then moving forward. Without that, there's really no healing. And without healing, you can't really build upon trust. So yes, trust is about also, you know, bringing in partners, influencers from the community to help share your message, people who are known and trusted among community members. I would say we did a small survey just among our own patients and community members about vaccine hesitancy. Yeah. And asked, who do you trust? Now, you know, there might be a bias on who responded, but the number one answer was their doctor. So I think with that comes an incredible privilege in terms of understanding that role and taking that role and making sure you communicate with your patient, not trying to bust myths, but meet them where they're at and have authentic conversations.
Dan, I'm your perspective, this degree of authenticity and you know, building the sense of community and true relationships. But CVS, corporate entity, you've got targets and stuff, how do you have that conversation, right? Where you have a fiduciary responsibility to build products, but you also have a very kind of core community sense. And are those at odds, or can those actually be symbiotic?
Great question. I would say certainly symbiotic. And then, to your earlier question, how do you build trust? I think there are a number of ways to do it. But ultimately, the words of a person or an organization have to match their actions, right? So you can't. So yeah, we were just talking about CVS pulling cigarettes from the stores back in 2014. I think that was, we want to be a health company, a healthcare company. And how can you do that if you have tobacco in the front of the stores? That is certainly, that doesn't make any sense. So that's an example of where we made sure the words and actions were aligned. I think as it relates to serving communities, certainly having the individuals in your organization reflect the communities you're serving is really important. And we have over, I think, roughly 300,000 employees across the company that are going to work each and every day, serving our customers and our patients, and really sort of living our culture. So as it relates to trust, I think we're one of the largest pharmacies across the United States, and every year there's a survey that says what sort of healthcare provider is most trusted, and it's neck and neck between nurses and pharmacists. But I think we really acknowledge as a company that there is this trusted relationship between a pharmacist and his or her patients. And so, when we're building a product called Pharmacy Panels, it's really more of a capability of the company where we are taking that trust and using it for the betterment of the patient's health. So essentially what this program is our pharmacists get individualized care nudges that are surfaced at the pharmacist when their patient comes to pick up their medication, and the pharmacist will take some time and provide some counseling to that patient. And we feel that that trusted relationship is an opportunity we can build off of to improve our patient's health. So we're starting to see some encouraging data come back that's important. But I think the point of me bringing that product concept up is that we really need to nurture that trust. And if we are taking advantage of the trust or not really deploying it in a way that helps our patients, will erode that trust. It's hard to build trust, but it's easy to erode that trust, as we've seen all too many times in society.
We got a question on the Q&A, and someone asked, and Dan right back is do you see CVS's role as a liaison between the patient and the provider, or that plus perhaps a new white space where you essentially might be the provider, you might be that one touch?
Yes, all of the above. I think we need to meet people where they are and how they want care delivered. I think when there's a great relationship between a provider, a physician, and a patient, we want to be there to just supplement, to reinforce appropriate health messages, and promote medication adherence and support those folks. But unfortunately, due to just the shrinking base of primary care providers across the country, we feel that we can provide clinical care when appropriate, and help people manage chronic conditions. As the population gets older, more and more people are accumulating chronic conditions, which is to be expected in the aging process, but also just the American lifestyle. It's harder and harder to just manage people's health. So we really want to supplement the work primary care physicians are already providing to patients, and provide support around wellness, nutrition, encourage exercise, sleep. So we feel that we can either reinforce that relationship between a physician and a patient, or even provide some basic primary care services as well when appropriate.
Can I ask? my brain is spinning like, in Melba, you said, gosh, our job is to connect these dots, and I see actually more dots. And I have a question. There's a lot of unbelievable innovation and ingenuity solved at a very local and personal and community-based level, but taking it up a level, how do we, scale? How do we bring scale? How do we ensure that one community's best practice is shared and disseminated? One clinic that's doing something truly novel and impactful is getting surfaced. What is our obligation, or whose obligation is it to surface these practice innovations, and how do we coordinate so we're not, creating duplicative and sometimes confusing efforts?
In thinking about working with communities, I'll use the example of the testing, COVID testing. I knew I had health centers. However, I had to dedicate my staff to be in those health centers to provide the primary care services, so that the providers were meeting their productivity levels, so that we were getting reimbursement in to cover our expenditures, right? So, the circle. But there was an immediate need, and working with the National Guard, classic example. You turn to, okay, who has the capacity at that moment? We use the National Guard until such time it's building blocks. It was building blocks for me until my partner, who received CARES Act dollars, opened up a contract, an RFP, for another entity to be able to cover the entire community. So it's starting small, knowing your community, if you're working with your community, and assessing and getting input from your community partners. That was key. I said, well, I can do this. What can my community partners do? And that's the same approach I'm taking with the vaccines, because what we know is, in one community, I might have individuals who are mobile. They can ambulate to our closest facility, but we might need to have special care to go in to a facility, into a community where people are familiar with that agency or an organization. So you really leveraging that leverage of change and working with your community members and your community partners. That's the approach that I take.
Nazleen, you're kind of at the crossroads clinically, and also from a community integration standpoint. How do you keep your proverbial hand on the pulse of these innovations, but also think enterprise-wide or scale? How do you avoid being stuck in that cycle so hard and working nonstop that you don't take a step back and kind of give yourself a pause and reflect and learn and grow? What's that?
Yeah, I think it involves a team. So making sure you have a team that's not just thinking about the healthcare sector, but if we're really thinking about health in all policies. So I love the example of CVS and taking out smoking. We should have more businesses, because that's a huge, huge cost to corporate America when their employees smoke, for a whole host of reasons, including also folks who do real estate or housing. Same thing, huge cost. So thinking about other partners and connecting community health with economic prosperity and vice versa, these are inextricably linked. And the more we don't pit them against each other, and we don't know, sometimes this happens where we think business, there's like a bias. Business is all about making profits and return, and public health is all about giving people rules and regulations, but actually working together. I think that's sort of a start. The education sector. So thinking about the role, not just about health, but presenteeism and absenteeism in school, in the workforce. Thinking about the law enforcement sector, the faith sector, which is often a place that people sort of lean into when we have public health messages or community health messages. And then, yes, the traditional healthcare sector, including non-traditional partners like CVS and retail pharmacies. So I think that becomes incredibly important to make sure we are really thinking of an interdisciplinary team to inform this conversation. So it's not the same conversation. The choir is not constantly talking to each other about what the right thing should be doing, but actually helping to operationalize it. You know, prior to COVID, I'll just say this one, but prior to COVID, there was an opioid epidemic, still is. And that's when you saw, when there tends to be these regional community groups that get together, but that's when you saw the CEOs of companies showing up at those, because they could not get employees to be able to pass a drug test, and they were not able to hire. We're not in that situation. We're in a different situation now, a few years later, but it's that same kind of conversation, understanding what the value is to different sectors and making sure that there's sort of that team approach. So we have different perspectives in the work that we're doing. And at the end of the day, right, we want to create the healthiest communities for everyone. There are some nice examples. Eastlake, Georgia, a community that was like in poverty. A lot of investment in community economic development has completely turned around in terms of violence, in terms of graduation rates, in terms of people having jobs and affordable housing. The blue zones, these are like these are global communities where people are living longer, are free from disease, and have tribes where they respect their elders. So there are these examples that actually we live in right now that we can just learn from and move forward. So there's a lot of great evidence-based work that we can just disseminate and learn from.
So if I'm a patient listening to this and I hear the amazing thing that CVS is doing and the amazing things that the community and the commissioner is leading and then the Cleveland Clinic, how do I navigate this? What is the role and whose responsibility is to kind of coordinate this effort? We almost have an embarrassment of riches or dots, but how do we connect them? How does a patient navigate this, what I'd say somewhat fractured and disparate effort, all trying to solve the same thing, but from a patient-centric standpoint, how do I navigate this? What's the role of a transitional care coordinator, and where should that live?
Well, you know, go ahead, Dan.
Thanks, Dr. Moore. Well, I'll tell you a little bit how we're trying to simplify the patient journey, because it is so confusing for way too many people. So we've acknowledged this issue, and I think CVS is really unique in that we have so many stores across the country. And so we're in the process of building out what we call them health hubs. So there are CVS stores that have a larger array of healthcare related products. We have a more robust clinical offering with nurse practitioners, pharmacists. But we also have care concierge. So that's an individual in the front of the store that greets people and tries to understand what their unmet needs are and helps coordinate them. And if they have Aetna, connect them to their Aetna care manager. So that's what we have underway. But just sort of taking that example a little bit further. So behavioral health is just such a challenge in the United States. There are so many behavioral health deserts, and primary care doctors oftentimes really struggle with helping people with mental health conditions. So we have a pilot underway where we put licensed clinical social workers in a number of our health hubs, and the role of this social worker is to help people navigate behavioral health challenges, but also social work related issues. And I think we're starting to see really promising engagement with community members working with our social workers. And then, so that's one offering. Another partnership that I'm particularly excited about is our partnership with Unite Us. So what Unite Us is a company that curates resources in the community that address social determinants of health, including employment, food, safety. And so our clinicians in these health hubs can also connect people to Unite Us to get sort of simplify the journey and get the care they need, whether it be clinical care, but also social determinants of health.
We also just joined Unite Us. So it's one of these platforms where you can screen people for their health-related needs. But what's so great about it is you can actually track, there's many other vendors, but you can actually track their outcomes. So it's not just about the referral process. You can actually find out, did your patient get the services? And if it did, can you track the outcomes? Did it make a difference? So we have some better data, actually quality data that could be actionable.
Yeah,
You know,
Yeah, go ahead.
I'm listening to Dan and Nazeel, and I'm really happy to hear that. I did my dissertation on the efficacy of patient navigation in women completing breast cancer treatment, specifically their chemo treatment. And I found that, you know, if you know anything about Harold Freeman, that's the model that I was really looking at. And it's the dot connector for me. It's the person, and we look at them as social workers, care coordinators, promotoras, village guides, whatever community you're in.
Community health workers.
Community health workers, that they're so important, you know, and to hear what CVS is doing, because whenever I think about a pharmacy, I think about when I have to go in there, I need to talk to somebody immediately. And it's that pharmacist, I ask a million questions of, and they're patient, they give me the information. I leave there with, I'm going to do what I was told to do. And it's,
sounds like a CVS.
it's the same process. You know, that's what I'm saying. We all know that this works. We need to continue to leverage this in our communities because you're in the community. Cleveland Clinic's in the community, CVS is in the community, public health is in the community. So no matter where people go, whatever door they go in, they have a trusted person there that will kind of help them navigate through the process and get them to what. And I love that it's tracking outcomes because that's what gets funded. Of course, I would talk about funding.
But that's, yeah, go ahead.
No, I was just going to say that, you know, it is hard for a patient to navigate all of this, and it does help to have care partners. But even for our own distinct entities, it helps to have a neutral convener, whether that be a foundation, a public health department, or some neutral entity that can bring folks together. So would really advocate for that continued effort.
Absolutely. I mean, it is this ecosystem of partnership, but all
Yes.
kind of rowing in the same direction. We got a really interesting, they're all interesting question from the audience, but I thought this was interesting. Are there any concentrated efforts for younger populations to, quote, nip mistrust and apathy in the bud? So the general concept is you know, we can't change the past, but is there a surgical approach, not a surgeon, you know, to address this in the young and make them, you know, evangelists of this kind of trust and community?
We've worked with, one of my community partners works with some young people. We call them the young influencers. And you have to take the time to carve out the space to work with them for real. I mean, they're not a challenge. You know, one person is a radio personality. And here we were moving along. All this is so new in my brain because it happened within the year.
Mm-hmm.
Moving along, doing, you know, trying to get testing going on. And the community partner stopped and asked these young people, you know, what should we be doing? Where should we go? And they said, well, first of all, you should start it later in the day. And, you know, and that immediately went, what do you mean later in the day, you know? And it gave us a date. It was a Saturday later on. That particular testing site had the most people at that site. And we have had town hall meetings with them to talk to them, let them ask as many questions as they want. So I will continue to say it's important that we support community organizations that are working with our young people, because I'm going to retire one day, you know, and we need to be paving the way to them. I mean, they gave us factual information, told us where to go, what time to be there. And the numbers came, and it's the same thing. And they say, tell me how this works so we can dispel these myths. This is what they're saying to us. So I think we need to continue to offer these science careers in our high schools. We prep them early, we gauge them in earlier, and work with them and go with what they say, because they're close to the community as well. their own immediate community. It will serve us well. They're really smart and intelligent, and can give you some good information.
I would say there are some national programs where young people have come together, really around bullying or loneliness or anxiety. There's this one wonderful program in Florida where they were noticing in high school and middle school, students, pre-COVID, students were sitting by themselves at like a lunch table. And, that can foster a whole, we all remember, a host of insecurities. And then there was a concerted, a concerted effort to reach out. And we're seeing more and more of these types of programs that actually have been led and formulated by young people. So for whoever asked the question, happy to share some national examples. But that's the type of thing that we also need to think about as we bring up, because that definitely helps to engender trust around different communities. There's an opportunity to listen and learn. So absolutely.
Yeah. Dan, are there specific kind of, those types of outreach programs? How does CVS kind of shape the voice in the message?
Good question. Let's just talk about the opioid crisis. I know Dr. Bharmal mentioned it earlier. So, we're still, in the middle of an unprecedented crisis as it relates to the opioid epidemic. And I think, the past few years, CVS has a program called the Pharmacist Teach program, and they send pharmacists, pre-COVID, into classrooms of, young adults to educate them about the harms of opioid use and misuse. But I think the pharmacists that go in there are particularly well trained to be very authentic and really consultative in nature. So that's one example where I think we are using our employees, our pharmacists, who are really passionate about this work to help influence and support young adults. But I think what it really comes down to, just from like a corporate perspective, is that whatever we do, we need to do it really well, repeatedly, and it takes a long time to build trust with really any consumer. But I think young adults are even more a little healthy skepticism. So, however, we present ourselves in the community of CVS, we need to be seen as authentic and reliable.
I'm curious, from each of your perspective, one of the things that has emerged, has always been there, but I think has really, really reared its head, is misinformation, and how digitally the propagation of misinformation, how has that actually shaped, influenced, and actually impacted our ability to, do the right thing and connect the dots? Melba, I'm just curious, how much time are you spending just educating versus trying to unwind the latest Facebook post?
I tell you, for every negative, you have to have, in my theory, 5 positive messages that go out.
5 to 1.
Yeah, because you're having to, that one message. I looked at this, that's why I said, check your facts. Something occurred last week. And it took Thursday, Friday, Saturday, Sunday to grab it and try to put it back in the bottle. And it was resolved yesterday. And it was small, but it was large. The impact of it was large. But, when I look back at what transpired, it was trauma, really. An individual experienced something a long time ago. So they come to the table with this above their head. It's going to happen. It's going to happen. It's going to happen. And in the engagement with another person, they took that on. It's going to happen. It happened. It didn't happen. Because all you had to do was just step back for a moment and have a conversation. And sometimes you're in the heat of it because of the trauma that's going on that you've experienced that you just want to fix it. I just want to fix it. I can't have this happen again. And that can overshadow. So that's why I said 5 times. And it was actually the 5 where I got that from: Friday, Saturday, Sunday, Monday, to really smooth it out. But I say, it is prudent upon all of us to breathe, take a moment, and kind of check yourself and say, is this me a year ago? Is this me? Is this something? What am I feeling right now? You really have to take that assessment, that self-assessment, and then dig through, take that time. And I know we're all busy and we're moving in a million directions and trying to get things done, but it saves on the short end of things if you just take that little moment.
So Nazleen, Melba touched on something that I know you don't have a lot of, which is time.
Right.
And so how do you balance a schedule where you're trying to educate the right thing to do, but there's so much misinformation? What is our capacity to handle that, get in front of it? How much of our capital needs to be addressed on managing disinformation, which breeds distrust, which is this, gnarly, and I won't use the word cancer, but it is something there that is insidious and it erodes. How much of your capacity and strategy is to get rid of that so we can do the good?
So it's a very interesting question. First, I just want to acknowledge there was misinformation before the internet. And it's because where people get, it's where people, and I remember when the internet came to being, I remember one of my professors was like, this is great, because everyone's going to be able to fact check everything and we're never going to get anything wrong. And wow, lo and behold. So I would say, in terms of an overall approach, I think it is really important with misinformation is to first, as actually Dr. Moore said previously, is understand our own biases and to check our own biases about how we are reacting to information that we might be hearing from somebody and where that might be coming from. So just want to set that stage. But secondly, instead of always battling myths and disinformation that might have a context that you may or may not fully understand, but maybe they got that information from their parent who they loved and they are truly believing in it, is actually to, I spend most of the time, and I have the team spend most of the time talking about shared values. I think that is where the biggest bang for your buck is. And I think I'll use the vaccine as an approach. I think there is a promulgation that happens where it starts to become a norm. You see more and more people get it. You see it, influencers get it. And it just feels like that's the thing to do. So that is sort of, I use a different strategy personally, and I ask the team to, which is think about things like hope, love, getting back to getting a hug, things that we have as Americans, but as overall community members, shared values. So as opposed to spending the time, which I think can actually be quite emotionally draining, on fighting misinformation, which there have been studies that show that actually it helps people get more entrenched in their beliefs instead of countering beliefs. Lead by love. Lead by love.
Also, mic drop. Dan, I'm curious from a CVS perspective is how do you, what are the concrete things as you develop new products, programs, and influence, shedding the past of that, hey, we're just a pharmacy. You go in there when you're sick, you talk to a pharmacist, and that's it, to more of a conspicuous, integrated, essential piece of the overall health puzzle.
Sure. Yeah, absolutely. So I'll first start by saying when we build products, we, in addition to getting feedback from end users and co-creating these products with, the people we're trying to serve, I think working with partners, really credible partners, whether it be the CDC or specialty associations like the American Diabetes Association, we really rely on those folks to bring their deep insight, clinical insights and expertise but also, frankly, their their enhanced brand of credibility. So that's particularly valuable. We also work with clinicians who still, I still practice medicine, so I feel like I have a better understanding of how healthcare is delivered, from my vantage point, than somebody who's not a clinician, let's say. I think that's really valuable. And then I think also just having a continuous feedback loop with the people using our products, and we're working really hard to set up a robust feedback cycle. So knowing the products we provide are bringing value, improving health, exceeding expectations around experience, I think is really important, and then continuing to iterate on that product improvement. So that's sort of how we think about clinical product. I do want to talk just a little bit about the spread of misinformation. It's just such an important topic, and I think just we saw when COVID just hit the United States in February, March, April of last year. I was working with a number of leaders at CVS, and it was just, we had to balance all this new information coming out with sort of the need to act expeditiously. So, I think that the company did just a fantastic job threading the needle. I remember just reviewing these preprint research articles around risk factors with COVID or new treatments. So being able to sort of balance and understand where the source of information is coming from, and frankly, weighing the believability to that, I think is important. But to Dr. Bharmal's point, disinformation is, as old as just humanity, right? But I think just the torrent of new information, both good and misinformation, is a challenge. I think we all have to, grope our way towards the right answer, and I think it is truly the challenge of our time.
So one of the, and we're coming up on time, but one of the core threads was data, right? We need to be informed, and then it needs to be shared. And this last question, I had a really good question, but this individual online has a better question. And they said, it sounds to me like, how does, the public actually play a role, and how can, or are there central databases and data that's available to the public to inform, educate, and empower? And what's the role kind of us to kind of make this as readily available, as transparent, and actionable for all members of our community?
I would like, to say future investment, future being tomorrow, if we could do it, is invest in establishing the infrastructure to support. Each health department has its own little website. Mm-hmm. And right now, what our seniors are saying is that, and many of our seniors don't have access to email and all of that, but to be able to go to one place and see the information, and what we've done to, and when I say it's a patchwork in process, it's not being critical. It is, you're nimble enough to recognize what you need, and you pull it together. We have 211 who is actively taking telephone calls, because we know that there are people who cannot navigate these websites and things like that for finding an appointment. There needs to be one universal system that is like the spoke and wheel model. The system and all the spokes from it lead to that. If we could get to something like that. I think what I've seen during the pandemic, along with cases and things like that, is the need for building this infrastructure, public health infrastructure, funding, adequate funding for public health. We have been, I have to say, we've been working on a shoestring for decades. And we're appreciative, if any legislator is listening, and very appreciative of what we receive. We need more so we can be even better. And so that whatever the needs are for the Cleveland clinic, they have it. And whatever CVS is in need of, you go straight there and you see it. And make it simple for our community to be able to tap into it so they can see. Because as I said, all of our health departments, we have websites. And some of them are easy to navigate, some aren't. But to make it easy for our community to navigate them and understand the data and what it's saying and what it means to them, and then empowering them with what they can do to be a part of this process of changing the narrative.
I think this is a place that's ripe for innovation. So there's data everywhere. Having data that's actionable to a public health department, to a corporate entity, to a healthcare system, a system that is our system that is excellent at managing complex care. But there's an opportunity to think about prevention and addressing the root causes of health and illness with our partners. This is an area ripe for innovation, not only just and there's a lot of places, there's Google, there's Fitbit, there's just like so much data everywhere, but to make it, to bring it together and to make it so that people can understand it. I would say the trusted resources that I often go to are two main entities. One is definitely the CDC and all the publicly available data sets they have. But is that somebody that a layperson can like use and download? I personally don't think so, but yeah, you can do it. And then second is some foundations. Some foundations like Robert Wood Johnson Foundation and some of their partners have some great like rankings, like health rankings, where people can understand nationally how your census tract is doing related to health information. But again, that's just information. Whether or not an intervention makes any difference on that, on that data once you've collected some baseline information, hard to know. Ripe for innovation.
And Dan, your thoughts and your CVS checkbook that could, fund the super highway of infrastructure.
I think the how we can figure this all out is how you balance all the data, the technology, the digital, and marry that with the in-person, the human relationships, and helping people, clinicians, social workers, community health workers, take all that information, interpret it, and then serve it up in a way that really resonates with the people we're serving. And I think that's the challenge at hand, and that's what we're working to do at CVS.
Well, I wish to recognize each of you for this. I think, Dan, to steal your words, while the technology and some of these innovations are important, what really makes this special is the human connection and the passion, the creativity, and the determination that even despite all of the historical precedents and the obstacles, there's overwhelming optimism that we can and we will and we have to address these important issues. So Dr. Knecht, Dr. Bharmal, Dr. Moore, I wish to thank you for joining Health Amplified. It's been a tour de force, and we have a tremendous road ahead. But I think, again, as colleagues and collaborators, this is an opportunity. So thank you.